Hello and welcome to this video presentation of Vital Signs Skills Assessment. I am Stephanie Ann Domingo with student number 474430. Today we will walk through the proper procedures, equipment, and infection control practices used to measure the four primary vital signs: body temperature, pulse rate, respiration rate, and blood pressure. We'll also cover factors can affect accuracy and the normal reference ranges for each vital sign. For this assessment, you will need the following items from your student medical office assistant kit. For the body temperature, blood pressure kit, it digital thermometer, sphygmomanometer for every or BP cuff, and the procedures that we need to use digital thermometer, wristwatch, and a hand sanitizer. Body temperature is one of the four main vital signs that must be monitored to ensure safe and effective care. It is important to measure it accurately. To do this, you need to choose an appropriate measurement device and to measure temperature using one of the common methods described in the video. So there are three methods to use to measure body temperature. The oral method. The oral method involves placing a digital or electronic thermometer under the tongue in the sublingual pocket with the lips gently closed around it. The auxiliary method is used by placing the thermometer in the armpit with the arm held firmly against the body to ensure the good contact. The rectal method is considered the most accurate way to measure core body temperature, especially in infants or critically patient. To begin with the procedures, always follow infections prevention protocols. So number one, perform hand hygiene using soap and water or alcohol-based hand rub or the hand sanitizers. Use gloves if it's in contact with the bodily fluids. Disinfect equipment before and after use. And of course, dispose of the cover and clean the thermometer. And definitely always maintain a clean work area.
I will be showing to you the auxiliary underarm body temperature. First thing first, we have to disinfect the unit. Then after disinfecting the unit, you have to turn on the thermometer. Make sure it's on before you use it or you're putting it in the armpit of the patient. So ask the patient, discuss everything that you need to do before the procedure. So ask the patients to lift their arm and place the thermometer high in the center of the armpit. So lower the arm snugly against the body to ensure proper contact. So wait for the beep, and then after you hear the beep, you can remove the temperature. So now record the temperature, dispose the port cover, and clean the thermometer after. I will be showing to you the auxiliary underarm body temperature. First thing first, we have to disinfect the unit. Then after disinfecting the unit, you have to turn on the thermometer. Make sure it's on before you use it or you're putting it in.
You should know that there are some factors affecting accuracy of the temperature measurement. They include recent ingestion of the food or fluid, having a respiratory rate below 18 per minute, age, time of the day, physical activity, environment temperature, menstruation cycle, presence of skin secretion, clothes, and smoking. The second vital sign assessment is the pulse rate. The pulse rate is a measurement of the heart rate or the number of the times of the heartbeats per minute. So you can use a watch with a second hand or the digital timer. So when taking your pulse, using the first and second finger of your tips, press firmly but gently on the arteries until you feel a pulse. So begin counting the pulse when the clock's second hand is on the 12. Count your pulse for 60 seconds or 15 seconds and then multiply by 4 to calculate beats per minute. When counting, do not watch the clock continuously but concentrate on the beats of the pulse. So if unsure about your result, ask another person to count for you rather. So always begin by performing hand hygiene using soap and water on our alcohol-based hand sanitizer. This helps maintain infection prevention and control throughout the procedure.
Use the pads of your index and middle fingers to gently palpate the radial artery located at the thumb side of the inner wrist. Do not use your thumb as it has its own pulse, which can interfere the accuracy. Once you feel the pulse, look at the watch or timer with the second hand. Count the beats for 30 seconds, multiply by 2 to get the beats per minute. If the rhythm is irregular, count for a full 60 seconds for accuracy.
In this segment, we'll demonstrate how to accurately measure a patient's pulse rate, including the best practices, technique, and important factors to consider. The pulse rate is a key vital sign that reflects the heart functions and circulatory status. So what are the factors affecting the pulse rate? There are many things that can increase or affect your HR, or heart rate rather, including exercise, stress, hot and cold weather, emotions, medications, caffeine, alcohol, smoking, and sodium intake. So the third vital signs is the respiratory rate. Your respiratory rate or your breathing rate is a number of the breaths you take per minute. So the normal respiratory rate for an adult at rest is 12 to 18 breaths per minute. And a respiration rate under 12 or over 25 breaths per minute, while resting may be a sign of an underlying health condition.
Begin by performing hand hygiene using the alcohol-based sanitizer. This is very essential before any patient interaction to prevent the spread infection. So ask your patient to sit down, relaxed, and the chest there should be visible and clothing should not be restricted to movement. So it is very important that the patient is unaware you are observing their breathing, as a conscious awareness may alter their respiratory rate. So pretend to check the radial pulse on the patient's wrist while holding the wrist. Discreetly watch the rise and fall of the chest. So count one full breath, one rise and one fall of the chest. Count for 30 seconds and multiply by 2 to get the respirations per minute. If the breathing is irregular or shallow, count for 60 seconds. So document the respiratory rate along with a notable observation about rate.
Hello and welcome. In this video, we'll demonstrate how to accurately measure a patient's respiratory rate and one of the four essential vital signs used to assess a person's overall health status. Several factors can influence a person's respiratory rate, including the psycho or physiological condition, environmental factors, lifestyle choices. So these are the factors can affect the body's need for oxygen or its ability to expel carbon dioxide, thus altering breathing patterns. So the last one is the blood pressure. When your blood pressure is measured, there are two numbers that come up. That's the diastolic and the systolic. A blood pressure chart shows you whether these numbers indicate low, normal, or high blood pressure. Hello and welcome to this demonstration on how to measure blood pressure, one of the key components of vital signs assessment. So blood pressure reflects the force of the blood against the arterial walls as the heart pumps and relaxes. Accurate measurement is essential for evaluating cardiovascular health.
Before we begin, let's go over the equipment you'll need: a blood pressure cuff, a stethoscope, alcohol wipes, and a watch or timer with a second hand if needed. Make sure equipment is clean and functioning properly before used. First, explain the procedure to the patient and get their consent. Ask the patient to sit down and relax for at least 5 minutes before taking the measurement. Their arms should be supported at heart level with the palm facing up and the feet flat on the floor. Ensure the patient had not taken caffeine, smoke, or exercise in the past 30 minutes. Wrap the cuff snugly around the upper arm, about 2 to 3 centimeters above the end of the elbow. Make sure the artery marker on the cuff is aligned with brachial artery. Check that cuff size is appropriate. Using the wrong size can lead to inaccurate results. Use your fingers to locate the brachial artery just above the elbow crease on the inside of the arm. Place the stethoscope diaphragm over the spot and not under the cuff. Inflate the cuff to about 20 to 30 milligrams above the point where the radial pulse disappears. Slowly release the pressure at the rate of 2 to 3 mmHg per second. Listen carefully for the cough sound. The first sound you hear is the systolic pressure. When the sound disappears, that is the systolic pressure.
So there are many other factors that are completely preventable. So these include obesity, smoking, excessive alcohol intake, like your physical inactivity, and a high salt diet. So smoking and alcohol also cause the blood vessels to constrict or become smaller, causing the pressures to increase. So high salt diets cause water retention, so which increases the volume of the blood that moves through the body, which also increases the pressure. On this slide, the key or the list of the resources or sources used to support the information presented. These references ensure the accuracy and reliability of the content, reflecting current standards and the best practices.